Hi, I'm Dr. John Lipman. I'm the founder and medical director of the Atlanta Fibroid Center here in Smyrna. For the past 25 years, I've dedicated my medical career to care for women suffering with uterine fibroids. I've always felt there's a better way than surgery. Most patients suffering with fibroids only hear about the surgical options, most commonly hysterectomy. We have things here that hospitals can't even provide. We have one-to-one nursing care. We have an easy, accessible facility designed for women, by women. Every patient has their own private room and their own private nurse. A lot of patients ask me, can I have children after a uterine fibroid embolization procedure? The simple answer is yes, you can. We've had numerous children born after UFE. We've had multiple sets of twin births. Our births are typically full term and vaginal, whereas if you have surgical myomectomy, you will have a C-section. You won't be allowed to have a vaginal birth. Patients will tell me, my fibroids are too big, or I have too many fibroids. My doctor said I wouldn't be a candidate. That's just a myth. Fibroids are never too big, never too many. Patients will say that if I have a UFE, I'll go into menopause. That's a myth. Patients will say, I can't have children after UFE. Again, another myth. Fibroids are commonly diagnosed on pelvic ultrasound, usually performed in the gynecologist's office. And patients will ask me, well, I've already had a pelvic ultrasound. Why do I need a pelvic MRI exam? Well, when you come in for your consultation at the Atlanta Fibroid Center, you'll see why it's so important to get an MRI, because the MRI has a much higher resolution than ultrasound. Ultrasound commonly underestimates the number and size of fibroids that a woman has. Commonly, I'll have patients say, well, I know I have 2 fibroids, we've been following them for years, and they get the MRI with us and they see they have 10, 12, 15 or more. And they're like, wow, where did all those fibroids come from? Before you decide on a surgical option for your fibroids, to come in to the Atlanta Fibroid Center for a consult with one of our physicians to talk about whether or not you truly are a candidate for UFE. Gynecologists, in all due respect, don't know all the answers about UFE, and you really need to see an interventional radiologist here at our center to really know if you're a candidate for UFE, and likely you are, and I hope we'll be able to treat you soon.